My name is Dr. Salma. I am a GP at Maypole Health Centre in Birmingham, and I would like to take this opportunity to encourage you to participate in the NHS bowel cancer screening programme. Screening programmes test to see if people show any early signs of cancer. By detecting bowel cancer at an early stage, treatment has a better chance of working. NHS England has lowered the bowel cancer screening age from 60 to 50, and this is due to be rolled out shortly. You'll be invited to take part in screening every 2 years until you reach the age of 75. And if you're 75 and over, you can still ask for a screening test by calling the free bowel cancer screening helpline. In 2019, a newer type of test was introduced called the FIT testing. This testing checks for tiny amounts of blood in the poo, which could be caused by cancer. Although not the most pleasant of tests to do, bowel cancer screening can save lives. It is also conveniently done in the comfort of your own home. Bowel cancer is the fourth most common type of cancer in the UK, and the chances of surviving it has more than doubled in the last 40 years. If diagnosed early, when there may not be any symptoms, more than 90% of bowel cancer cases can be treated successfully. Screening can also find non-cancerous growths called polyps in the bowel that may develop into cancer in the future. Removing these polyps can therefore reduce your risk of getting bowel cancer in the future. The kit you receive through the post will have clear instructions on how to complete the test. First, write the date on the bottle provided in biro pen. You can either use a container or layers of toilet paper to catch your poo without letting it touch the water. Next, twist open the cap on the sample bottle. Collect a sample by scraping the stick along the poo until all the grooves are covered. Then, put the stick back in the bottle and click the cap to close it and wash your hands. Lastly, put the sample bottle in the return envelope supplied. Peel off the tape, seal the envelope and post it out as soon as possible. About 2 weeks after your test, you'll get a letter with your results. Most people receive a letter that says, "No further tests needed at this time." If your letter says further tests needed, this is because blood was found in your sample. This can be caused by other medical conditions and it doesn't necessarily mean cancer, but if it is cancer, finding it at an early stage means treatment is more likely to work. If further tests are needed, you may be asked to repeat the test, or you'll have an appointment with a specialist nurse at a bowel cancer screening centre. The nurse will talk to you about having a camera test to look at the inside of your large bowel. This is called a colonoscopy, which is the most effective way to diagnose bowel cancer and also a way to remove polyps from the bowel. During a colonoscopy, a thin, flexible tube with a tiny camera attached is passed into your back passage and guided around the bowel. Keep in mind that no screening test is 100% accurate, and a negative screening test doesn't rule out the chance of you developing bowel cancer in the future. So if you develop any symptoms that you're worried about, please contact your GP. If you have any questions or worries about bowel cancer screening, please speak to your GP, or you can call the bowel cancer screening helpline on this number. You can also call this number if you haven't received a testing kit or if you need a replacement kit. Thank you for watching.